Hi, I'm Dr. Mark Faber. I practice child, adolescent, and adult psychiatry in Upper Montclair. And today the topic I wanted to review is that which includes natural and alternative treatments often used or considered in psychiatry. In the area of depression, while we may certainly advocate for cognitive behavioral therapy and antidepressant medications, we do know that there are ways to supplement or assist the treatment response. One, for example, is the omega-3 fatty acid option. And in this case, it is the EPA component of omega-3, and that should be in adults up to 1 gram daily. In children and adolescents, we also consider EPA as opposed to DHA, which is also in omega-3. Next, we know that folic acid or folate can supplement to assist medical treatment for depression. And in adults, we often consider 1 or 2 milligrams of folate a day. And also, we may utilize low-dose folic acid in younger individuals. Now, folate needs to convert to something called methylfolate in order to cross what's called the blood-brain barrier. And some people are unable to make that, basically that transition. And we know this through some of our genetic testing in psychiatry, where occasionally we might do that testing and demonstrate whether a person can or cannot convert folate. In the event that they cannot convert it, then there is methylfolate, which can be taken directly and can also boost the effect of other medical treatment. Vitamin D and vitamin C have both been looked at, although not critically in terms of double-blinded trials, but either or both might also be helpful. And finally, a non-medical but complementary quote-unquote treatment is exercise, and indeed we know up to 5 days a week, pretty vigorous aerobic exercise, 30 to 45 minutes at a time, will enhance neurotransmitter activity and also assist with mood. Another complementary or alternative treatment is called NAC, N-A-C, N-acetylcysteine, and this at 600 milligrams twice a day or 1200 milligrams twice a day can actually assist with repetitive hair pulling, skin picking, nail picking, and may diminish that. Interestingly, use of NAC might also reduce craving by young people who may wish to use, for example, marijuana. Let me move on to melatonin as an alternative or complementary treatment. And we know that melatonin for delayed sleep phase given 1 milligram at 6 p.m. will assist in shifting the sleep phase earlier. And we need to remember that elementary age children should have lights out 10 hours before arising, middle schoolers 9 hours before arising, and high schoolers 8 to 9 hours before arising, the light should be out, because light entering the eyes may actually decrease our body's own production of melatonin. Finally, in terms of light therapy, we know that this can be helpful for seasonal affective disorder, or SAD, but we have to be careful with light or phototherapy for those that may have bipolar disorder in the depressed phase, as it might cause some degree of activation. These then are the complementary, if you will, strategies that can assist our traditional treatment approaches in psychiatry. Thank you.